Hi everyone, Drew here from Navina Thai Yoga Therapy. Today I wanted to talk to you a little bit about plantar fasciitis and the impact that Thai massage can have on that. And especially if you're a practitioner, what type of things you can consider in your treatment approach to help enhance those benefits. Really briefly, one of the things about plantar fasciitis that isn't as commonly understood is that even though the name might suggest it's an inflammatory condition with the ending of itis, it actually isn't. They've discovered in recent years and recent studies that it should be more accurately called fasciosis, which is just an irregularity of the connective tissue. The reason for this is because they're finding that the pain caused by plantar fasciitis is actually not the result of the inflammatory process. And in some instances, the inflammation is not even really a consideration in the amount of pain that people feel. And what they're finding instead is that it's the physical disruption of the connective tissue fibers, whether that's through tearing or just creating more space in between the fibers. That's actually what is causing the discomfort and pain that people are experiencing. So that's a good thing to know based on how we're going to be working with that condition, especially if you're a practitioner and someone's coming to see you in order to receive some help for this. What that means is because there's not as much inflammation to consider in the work that you're doing, you should know that you can actually approach the area a little bit more completely. So you can sink in and work into the area. Always make sure you're working really slowly anytime you're working around damaged tissue. And in doing so, you're going to actually be promoting blood flow and a tiny increase in the inflammatory response. And that's a positive thing because inflammation signals healing in the body. And when it's not present, then healing doesn't happen as rapidly. So increased blood flow is going to help to bring those factors to the area. And if we're working slowly and if we're not working in a way that's harmful, then we're going to be just increasing the blood flow to the perfect amount where a nice amount of blood is coming and a nice amount of the inflammatory factors are being drawn into the area. So that's one thing to consider, is now you can actually approach working with the plantar fascia, with the sole of the foot, more directly, knowing that the inflammation there is minimal. Also, think about the rest of the posterior chain of the body. If you've ever heard of myofascial meridians, the sole of the foot, the plantar fascia, is only one small part of a much larger kinetic chain, a much larger movement chain in the body that spans the full entire length of the back body and actually attaches to the frontal bone of the skull. So with the rest of your treatment approach, what you want to think about is anytime you see a string, anytime you have a string that's attached to 2 points, anytime you press on that string, you're going to see the greatest effect at those 2 points of attachment. In a similar way in the body, tension in the rest of the posterior chain might actually be the reason behind the plantar fasciitis. The plantar fasciitis in the foot might simply be a collection of tension resulting from everything else going on in that superficial backline of the myofascial chains. So what you might like to consider then is the rest of the work that you're doing to engage that chain. How else are you lengthening and releasing tension along the full posterior chain? You might like to focus a lot on positions that have people in hip flexion. So you're providing flexion to the spine as well. And that's going to lengthen the erector spinae muscles, which are part of that posterior chain. You'd also want to think about flexion at the hip and extension of the knee to lengthen the hamstrings, which are also part of that posterior chain. So as you approach working with someone with plantar fasciitis, consider those things. Working with the area directly, yes, it's always very good to do that, especially considering the decreased influence of the inflammatory response. And also what's happening in the rest of that chain. How can you work with the rest of that chain to release tension downstream in the plantar fascia itself? Okay, good luck, enjoy that, and always feel free to reach out and let me know if you have any questions about a Thai massage practice or if you're experiencing any discomfort in your own body. Thanks so much.